Globally, an estimated 58 million people are living with chronic hepatitis C, also known as HCV. For those living with HCV, approximately only 20% have been diagnosed, and even fewer have started treatment. While there is still a lot of work to do, what has been accomplished to date has paved the way toward HCV elimination. And in 2016, the World Health Organization set the goal to eliminate HCV globally by 2030. With less than 10 years to go, many of the so-called missing millions living with HCV are at the margins of society, without health systems designed to reach or support them. Micro-elimination can play a central role in achieving global HCV elimination. It involves developing a strategy to eliminate HCV in a specifically defined segment of the population, such as a small geographic area, a subpopulation, or an age cohort. This means that realistic elimination goals can be set, resources can be allocated where they are most needed, and local expertise can be supported to tailor, deliver, and scale up interventions quickly and more efficiently. The learnings from micro-elimination projects can be used to support national and eventually global HCV elimination. AbbVie is committed to working with the HCV community to achieve global HCV elimination. Across the world, we are supporting an estimated 300 micro-elimination projects, partnering with healthcare professionals and external stakeholders to elevate and prioritize HCV elimination. We know it's not just about science. It's also about society. We are passionate about building creative partnerships around the world to break down the barriers to HCV care and helping eliminate the virus in some of the world's most vulnerable communities. Global elimination is possible, and each patient getting the treatment they need brings us closer to that goal. Together, we can work towards making elimination a reality.
Good afternoon, good evening, good morning to everybody who's joining in the room and around the world. It's my pleasure to be able to welcome you to our session today, The Road to HCV Elimination, Collaborating to Break Barriers and Eliminate HCV in some of the world's most vulnerable communities. My name is Paul Sutton, and I'm the head of therapeutic area strategies in the International Government Affairs Organization at AbbVie. And before joining AbbVie, I worked for many years in the community-based HCV and HIV response in Canada, my home, where I'm from. And so I'm very fully invested in the topic of what we're covering today, which is really all about the partnerships that we need in order to be able to drive elimination in all of our communities around the world. I'm very excited to be moderating this panel and to be joined by two very esteemed colleagues, Lindsay Hebert and Cristiana Mirandario. And it's my pleasure now to be able to ask each of them to be able to introduce themselves and give a little bit of their background and what they're looking forward to discussing in today's panel. So Lindsay, why don't we start with you?
Thanks so much, Paul, and greetings to everyone joining us today. Really thrilled to be here and talk about partnerships. My name is Lindsay Hebert, and I'm the Associate Director for the Coalition for Global Hepatitis Elimination. I joined the coalition shortly after it was launched in 2019, about 3 years ago now. And I started in hepatitis elimination, working for a small nonprofit building investment cases to help countries that were just getting started on their path to building national programs. And got very motivated to join this cause. It's a really exciting time in public health, and I'm really thrilled to be here today and to talk about partnerships because that's why the coalition was started and what we're all about. So thank you again for the opportunity.
Great, thank you, Lindsay. And Cristiana, over to you.
So hi everyone. First, in the name of Kshira, I just want to thank AbbVie for this invitation and for the most welcome opportunity to be here discussing the collaborative work between different partners, which turns possible the development of community-based projects aiming at HCV elimination and improving the quality of services that we are provided to our clients. My name is Cristiana Merendeira. I'm a psychologist working in the harm reduction field since 2015. At CRECER, that is a community intervention association based in Lisbon, Portugal. I'm a project manager in programs targeting people who use drugs and who experience homelessness, including a point of care HCV screening and treatment combined with outreach work. That is named the REACH project, and that has been running since 2020.
Great. Thank you very much, Christiana. And so effectively what we're going to do over the next 20 minutes or so is a moderated panel and then a Q&A. And what I wanted to do before we run into the panel is to let everybody know, whether you're in the room or joining virtually around the world, that you can send to us through the Q&A function in the chat on the portal questions that you have throughout the session, and we'll look forward as we move toward the Q&A section at the end of being able to answer those questions. And so there's no time like the present to be able to launch specifically into our panel and our panel discussion. So the first topic that we want to talk about is how microelimination has a fundamental role in eradicating HCV in marginalized communities. And I think what I'd say about this is that many of the missing millions living with HCV, we all know, and as was said in the video, are living at the margins of society without health systems designed specifically to reach or support them. And we at AbbVie, we see it as our responsibility to accelerate efforts to help simplify the system for these populations. We're working with the hepatitis C community to support an estimated 300 targeted local microelimination projects through partnerships worldwide to move us closer to a world free of hepatitis C. And these projects really are helping fuel new models of care. And so based on this, Lindsay, I wanted to ask you to maybe dive a little bit more into the work that the Coalition for Global Hepatitis Elimination is doing, specifically around the community of practice you've launched. I think it's really been a delight to see over the last just 3 years or so, the community of practice that you've worked to bring together and the best practices that you're incubating and sharing and building up for governments, for healthcare providers, and hepatitis programs all around the world, driving toward the goal of elimination. So would you be able to tell us a little bit more about the community of practice, your objectives, and the accomplishments that you've had to date?
Absolutely. Thanks so much, Paul, for that question. And for those of you that are new to hearing about the Coalition for Global Hepatitis Elimination, we're still a very new and growing organization. We were just launched in 2019. And really our mission is to strengthen and expand the community of practice of government officials, clinicians, civil society, researchers, and other public and private partners committed to and working towards hepatitis elimination. The coalition itself is modeled off of other disease elimination programs at the Task Force for Global Health, which is our home organization in Atlanta, Georgia. These other programs are polio, leprosy, trachoma, onchocerciasis, and the list goes on. And so we've been working with our colleagues at the task force to build and model a program for hepatitis elimination. And what they've guided us to do is to really focus on 3 main areas. The first is supporting and connecting programs through creating additional opportunities for partners to share lessons learned, experiences, and data, and also providing technical assistance to help them do their work. Contributing to building the evidence base for hepatitis elimination through conducting research and producing resources that can further support program implementation. And thirdly, through these activities and partnerships, reinforcing efforts to raise the visibility of hepatitis elimination on the global health and broader global agenda, and mobilize additional commitments to bring those resources to programs on the ground. And so one example of our community of practice and action is our webinar series, which perhaps some of the participants have joined over the past few years. And so our partners have guided us in identifying priority topics for developing these collaborative webinar and meeting series around. One series is known as HepTest, and this focuses on operationalizing hepatitis testing strategies. Previous sessions have focused on exploring screening algorithms, looking at the best models for point of care versus laboratory-based testing, looking at integration of hepatitis B and hepatitis C antenatal testing into syphilis and HIV programs, and more recently on hepatitis B reflex testing. We also have a series on hepatitis B burst dose, vaccine introduction in the African region. Another series on innovations in hepatitis elimination, really trying to bring forward those microelimination strategies and lesser known programs. And another series on working with the US NIH on translation of research into public health practice to help fill that gap. On building the evidence base under the guidance of our technical advisory board, we also have been working to identify research gaps that a multi-country collaborative effort could help fill. So one of our first studies and initiatives was with the Clinton Health Access Initiative, bringing together data to look at retreatment options for patients in low and middle income countries where the branded drugs aren't yet available. And then just recently with the US CDC, we launched a registry for collecting clinical case data information for pregnant persons exposed to hepatitis C to expand the information available for providers and patients making decisions on whether pregnant persons can be treated. And then the last example I'll share is our National Hepatitis Elimination Profile Initiative, which is really dependent on building partnerships with government, civil society, clinicians, and experts to bring together key data related to assessing progress towards hepatitis elimination, with a unique focus on going beyond just the burden of disease and metrics for elimination, but looking at the components of a hepatitis program that's sustainable over time and that policy environment associated with it. So to date, we released 12 profiles. Ethiopia and Pakistan's profiles just came out this week. And we're so excited to work with more countries in this initiative over the coming year. So I think the main takeaway is the coalition is here to facilitate collaboration and partnership, and we welcome your ideas of where new partnerships may be possible in the future. Thank you.
Great. Thank you so much, Lindsay. And again, it's really very impressive to see all the things that have been done in such a short period of time and the bridges that the coalition has been able to build between countries, and also really linking the evidence and the continued unmet needs that we have in the evidence to the policy gaps and the calls to action. And so Lindsay's given us, I think, a nice sort of global view of this kind of incubator role. Christiana, we'll turn to you because I think it'll be really nice to hear about some of the great successes that you've had with micro-elimination programs in Portugal. And I think the question that I have for you is, what's been critical for the success of these programs that you've been involved in leading and incubating in Portugal yourself?
Thank you so much for the question, Paul. I will share some slides now. And I will say that microelimination is a very pragmatic, a very tailored approach to pursuing HCV elimination goals that works very well matching the needs of the most vulnerable populations. I refer people experience homelessness, people who use drugs, and migrants, and also engaging multi-stakeholders in this process. And fortunately, we have good examples of this approach in Portugal. I don't know if you are seeing my slides now. Okay, I think, okay. Perfect. So Crescer is an NGO that has been developing outreach work based on a harm reduction philosophy for 21 years now. We approach HCV testing and treatment with this harm reduction framework through a specific outreach intervention, which includes meeting people where they are and developing a relationship-based intervention. As you can see in these pictures, our teams goes by foot with a backpack and meet people in their environments, like drug trafficking neighborhoods, the woods and other open drug use spaces, abandoned buildings, among others. So this outreach proximity approach has been one critical aspect of reaching people who use drugs and are in extremely vulnerable situations. Another aspect to highlight is the total decentralization of healthcare. So antibody and RNA testing are done in the field, in positive cases, also blood analysis, and with the support of Santa Maria Hospital, that is a major hospital in Lisbon, specialized appointments are done also in the community. Another critical issue is formal peer work. So people with lived experience as specialized harm reduction technicians, integrating Crescer teams and working directly with our populations. And also, I would say informal peer work through the Bring a Peer strategy we also use. And both of them promotes people's connection and trust. When we complement this with financial incentives, we see that this increases people's adherence. And I would finally highlight that to set up this kind of project, the engagement of different stakeholders is essential. So I would turn to the other slide, and maybe just to finish saying that outreach proximity approach, decentralization of healthcare, peer work, financial incentives, and the engagement of different stakeholders are the critical issues I want to highlight.
Great. Thank you, Christiana. That's really very insightful. And I think it's really, truly impressive the way that you've done your work to, I think, hit at what we've all really discovered, you know, especially for those of us who've been doing this for a long time, that you really need to meet people where they're at. And that's going to be really the main thing that we need to do to be able to achieve these last many miles that we have toward achieving the goals that we have for global elimination. And so I think what we want to turn to now is the value of community partnerships in achieving HCV elimination. We've already talked about that a little bit, but maybe I'll start by saying we all have a part to play. Certainly we recognize at AbbVie our role in making hepatitis C elimination the next public health success story, and that these transformative partnerships are essential in helping to solve some of the most pressing challenges. And so, Lindsay, I'm going to go back to you. And the question that I have for you is, could you tell us from your perspective why community partnerships are so important in achieving HCV elimination, as well as some of the best examples of this that you've seen?
Well, I think first to say the summit has highlighted how community partnerships are vital to the success and planning and scaling hepatitis elimination programs. And it's just been a privilege to be a part of it and see all of the wonderful examples from around the world. I think these partnerships ensure hepatitis programs are informed by patients and by lived experiences. And I think partnerships also help us maximize the limited resources we have in hepatitis elimination. And so I can think of examples from all around the world, but one that's top of mind is from a project we've been collaborating on in Ghana, known as the HEAT project, the Hepatitis Evaluations to Amplify Testing and Treatment project. It's a mouthful, but this project really built on the foundation laid up by civil society and organizations such as the Hepatitis Foundation of Ghana to bring together partners. The foundation of the project was to create a local coalition or revive a local coalition, in this case, of government, the Ghana Health Service, the Ministry of Health, civil society, the Hepatitis Foundation, key academic institutions such as Cape Coast University, and the FETP program, the Field Epidemiology and Training Program in Ghana, to bring these partners together to develop a assessment strategy for looking at the epidemiological burden and laboratory capacity for scaling up a hepatitis program, and then to have all those partners validate the information that was collected from the assessment and determine a plan forward. And so it's been really exciting to see the momentum coming from that collaboration, and the Ghana partners are now looking towards creating demonstration projects for elimination programs. Our National Hepatitis Elimination Profile Project has also brought to light many strong community partnerships from around the world. In some cases, these community partnerships are providing strategic leadership and vision for the whole country to achieve the national hepatitis elimination goals. We're currently working on profiles in Spain and Switzerland, and organizations like AHIV, the Alliance for the Elimination of Viral Hepatitis in Spain, and Swiss Hepatitis are really putting forth recommendations and visions out there for the country to follow. And then I think another strong example from the profiles is and the community organizations are stepping up to provide services when in some cases the government is not, especially in the case of marginalized populations and implementation of harm reduction services in countries like Pakistan. All harm reduction is supported by local NGOs and no funding from the government currently. And we heard similar situation in South Africa too, where there's funding from local government and NGOs, but not at the federal level. And so these community partnerships are really filling a gap in a critical intervention for elimination.
Great. Thank you so much, Lindsay. Much appreciated. And so I think, Christiana, it was something that just very small I took away from the slides that you shared is just the sheer number of partners who are involved in kind of bringing together the work that you're doing. And so what I wanted to ask you to speak a little bit more is what does community partnership mean to you from patient advocacy group perspective, from your program's perspective? What is your organization doing with regards to partnerships in HCV?
Thank you, Paul. A patient advocacy group perspective aims for better patient involvement in the design, the planning, the delivery of healthcare services. So for us, the starting point is to listen to people with lived experience and develop projects managing their needs and guidelines, like the RICHI project I was talking about earlier. Community partnership is what turns this into a reality. So in the RICHI project, CRIR promoted the initial contact and also maintains this proximity with formal and informal partners. And I would name community associations and groups, peers, amazing specialists from Santa Maria Hospital and Professor Rui Tato Marino team, Lisbon City Hall, Portugal 2020, that is an instrument financed by European funds, AbbVie, and also some specialized researchers. So this allows us to provide individualized support on different levels to the people we work with, like outreach healthcare using techniques adapted to their needs, promoting health education sessions, providing financial incentives, and just giving some examples. Also important to the quality of our work, I would highlight partnering with specialists in HCV and researchers to promote the dissemination of project results, which can be used to advocate for decentralized care. All of this turns the project into a successful reality, which means connecting healthcare with the most vulnerable populations.
Great, thank you, Christiana. And so that brings us to the last topic that we want to cover off in the moderated version, or the moderated section of this panel. And then we'll go to some of the great questions that have been coming in from the audience. Please keep the questions coming. The last topic is what needs to change to reach the 2030 elimination goal. And I think we really want to hear from both of you on this particular piece. 2030 is less than 10 years away, 8 years away now, and we really believe at AbbVie that addressing barriers to hepatitis C care will mean uniting all of us, healthcare providers, patients, advocates, caregivers, healthcare systems, in a collective effort to remove these obstacles. AbbVie's proud of our partners like the Coalition and CRESCR that address the lack of access to education and barriers like stigma and discrimination and other global challenges that can prevent people affected by hepatitis C from accessing care. And so, Christiana, I think I might go to you first this time to really ask, what would you say is the one key change, if you can get it down to one, that the community needs to be able to accelerate progress toward a 2030 HCV elimination goal like that's been set out by the WHO? So Christiana, maybe you first on this one.
Thank you. So I would say to increase the number of outreach and decentralized care projects, promoting the closer partnership between hospitals and community services, which for sure should include peer work and financial incentives to reach marginalized groups. It is important to develop an awareness in new generation of hospital specialists about the importance of community interventions in connecting with people in situations of total social exclusion.
Thanks, Christiana. Lindsay, what needs to change in order for us to be able to achieve the elimination goal by 2030?
Well, I think Christiana summarized it really well, but I think perhaps the greatest challenge we all face is finding the missing millions, as the World Hepatitis Alliance has rightfully called it. And I think there are so many opportunities ahead. So not necessarily a change, but a recommitment to that effort. And I think we are at a unique point in our hepatitis elimination journey where we have so many examples of success to build upon, as you said in the opening, and also coming out of the COVID-19 pandemic, it's a unique time in global health. All our societies and countries and institutions have been changed for the better, in some cases for the worst. And so how can we take advantage of those changes for hepatitis elimination and look for the positive and potential opportunities for leveraging investments in health systems. And I know that's a priority for the coalition, is thinking about how can we look for where there's been expanded PCR capacity, where is there more acceptance of self-testing, where are there greater infrastructure for training healthcare providers, greater community awareness of the difference between PCR and antibody testing and just generally infectious diseases, and to leverage that, come together at this moment to really identify feasible solutions and resources that can be applied to scaling up access to testing for all populations.
Thank you so much, Lindsay. With the couple of minutes that we have left, I'd like to turn to one, maybe two questions at most, some great ones that have come in from the audience. And I think the first one, Christiana, I'm going to put to you. And it's a question that came in around how we address structural barriers to elimination, such as the criminalization of drug use. And I wanted, Christiana, to get your perspective. You know, as we know, there's been a move toward partial decriminalization in Portugal. And so maybe some reflections to you on, you know, what has partial decriminalization, how has that maybe sort of improved your ability to be able to engage with the people that you're engaging with, and maybe what more also needs to be done? So Christiana, if you're comfortable answering that question, I'll turn it to you.
Of course, decriminalization stops the judgment about people behaviors, and allows us to focus on people themselves and their quality of life and their health, and also provides the connection between people and the services. And we need to use this connection to improve the screening and the treatment of HCV and other infectious diseases, and we need to reduce the prejudice towards these populations if we want to connect them with the services. So I would say that this is a base from which we need to start.
That's great. Thank you so much, Christiana. And maybe very quickly to Lindsay, just there was a question that came in around thanking you, of course, for sharing the inspiring work of the coalition, and maybe a bit of a question more around the work that the coalition's doing to translate research into public health programs. And we have less than 2 minutes left, so maybe, Lindsay, if you have one great example of how you've been able to translate the research into public health programs or informing public health programs.
Yeah, thanks, Paul. Well, I think the first step on that is getting the research out there, because I think so much of it is behind a curtain, if you will, really kept closely in these institutions conducting the researchers, and there can be a gap between disseminating what is happening. And so I think our first priority has been just creating opportunities for researchers to share their work publicly. That's not necessarily at a scientific conference, but that's open access. And we aim to record all our sessions where we have researchers come and make those available on our website and our YouTube and create that open access. But then I think to your point of how do you then get it into practice, I think it's those continued dialogue and creating those partnerships of seeing where those lessons could then be translated into the field. And so we've been aiming to not just have the initial webinar or the initial conference, but then to follow that up with actual partnerships and projects of partners coming together to actually see it happen.
Well, I'd really like to take this moment to be able to thank both Christiana and Lindsay for joining us on the panel today, for everybody for submitting the great questions. There were more, we've run out of time and we're not able to handle any more. In closing, I'd like to say that we know that curing hepatitis C is not just about science, it's about society. It's about the collaborations that Lindsay was talking about. It was ensuring that we're really respecting the full humanity of everybody that we need to engage into care in order to be able to eliminate hepatitis C. So while many of the missing millions may live at the margins and be harder to reach, acting now to help eliminate eliminate Hep C globally is critical for all patients, regardless of location or status. So to learn more about AbbVie's approach, to download the brochures in the flyer section of our virtual booth, please visit abbvie.com/HCV to be able to get more information about how our organization is committed alongside all of you toward hepatitis C elimination. Thank you very much for your attention today. Bye-bye.